Hi, my name's Neil. I'm a chartered physiotherapist with Spectrum Health. I wanted to dive straight in and just talk about 5 common back pain myths. The first one is if you have back pain, your back is damaged. To be honest, most people and most of us will get back pain at least once during their life. It's a pretty normal occurrence, a bit like getting the flu, but the vast majority of people do recover in about 6 to 8 weeks. Myth 2, pain equals damage. What if you have the worst pain imaginable? Your back must be in bits, right? Well, we know that there's a poor link between the amount of pain that we experience compared to any damage that's going on. Lots of other factors help turn up and amplify that pain. Things like worry, stress, anxiety, lack of sleep, poor diet, poor nutrition, poor hydration, whether you smoke or not. So it's important that we look not only just at the spine, but all the other factors that might be influencing your pain. Myth 3 is I need an MRI to find out what's causing my pain. It's pretty common to get them done these days, but most people don't actually need an MRI. Your GP or physio can guide you on that. And the reports themselves can be scary. There's lots of medical jargon, things like disc protrusions, reduced disc height, facet joint degeneration. It sounds pretty scary. But there's a great study that looked at loads of MRI scans for people's lower backs, people with no pain whatsoever. They found that if you were 30, 52% of people were likely to have some degree of disc degeneration, and if you were 50, 60% would have disc bulges. And these are people with absolutely no pain whatsoever. So more often than not, what we see on MRI scans are normal age-related changes. Think of it like grey hairs and wrinkles on the inside, really. Myth 4, take to bed and don't do anything. That was very much an old-fashioned approach, but these days we've learned that kind of gradual movement just helps speed up your recovery. Think of it a little bit like a sprained ankle. Once you sprain your ankle, it's initially sore, and then the next few days we're kind of hobbling around on it, but then it gets a little bit easier, so we can walk a little bit more comfortably and then start to walk a little bit further, and over the coming weeks we can start to do a little bit of gentle jogging and gradually end up with sprinting. Think of that as a way to approach your back pain, really, just gradually doing a little bit more every day with it. And myth 5, my bad posture is giving me back pain. We're all told to sit up straight as a kid, but yeah, there's a real poor link between a specific posture actually causing back pain. What we know now these days is that movement is key. So if you're spending 7, 8, 10, 12 hours a day sitting down or in the one position, that's not ideal for you. You need to try and break that up with little movement breaks. That's all from me. Take care. Bye.